We're going to have Associate Professor Rebekah Ahmed talk next. Rebekah is an Associate Professor and Specialist Neurologist with expertise in frontotemporal dementia and associated disorders. She is the Director of the Memory and Cognition Clinic at the Royal Prince Alfred Hospital in Sydney, and also conducts research with the Frontier Group in Sydney. Her primary research interest is in eating and metabolic abnormalities in frontotemporal dementia, and today she's going to tell us a little bit about future research and clinical trials.
So really what I wanted to do today was give you an overview of what research is going on in frontotemporal dementia, and then also talk about some really exciting clinical trials that are starting in Australia. Some of them have started and some of them are going to start later this year. So I'm part of the Frontier Group at the Brain and Mind Centre, and the Frontier Group really started in 2008 when John Hodges moved from Cambridge to Sydney, and he's since retired, but there's still a lot of fantastic research going on. And more recently, we moved to the University of Sydney and Royal Prince Alfred Hospital. So really what Frontier has focused on is all forms of frontotemporal dementia, but we've also focused on the overlap between frontotemporal dementia and motor neurone disease. And we focused on a number of aspects, including the genetic aspects, clinical aspects, and also the underlying pathology. And many of you have come to Frontier as part of our research program, and for that we're extremely grateful. So some of the research projects that we've got going at Frontier look at all aspects of frontotemporal dementia. So we've looked at cognitive aspects, including memory, my particular area of research, which looks at metabolic and eating abnormalities, social cognition, the overlap in between FTD and psychiatric symptoms, language problems, neuroimaging overlap, and also the overlap with motor neurone disease and other Parkinson's disease symptoms. And what we've really tried to do is get to the bottom of what causes FTD and how we can mark disease progression and eventually try and help come up with a cure for this devastating condition. We've also had a major arm of our research looking at the impact of FTD on carers and patients and quality of life. And more recently, we're involved in a number of clinical trials, which I'll go through with you. In terms of what we've really looked at is we've looked at these key factors and what brain structures control these factors. And that has really helped in the development of potential treatment options, because if we know what the underlying changes in the brain are that are causing these symptoms of FTD, then we can really look at treatments that may be able to target these changes. And one of the major areas that we always get asked about is what is the survival like in FTD, and what can people do to try and prolong survival and slow the progression of the disease. And more recently, we've looked at our survival data in all the patients who've come through with FTD. And these are the results of the patients that had behavioural variant FTD. And essentially, what we found is most patients have a median survival of about 10.8 years. And without dependence, that's 8.9 years. And patients with a shorter survival tend to have a shorter disease duration. They have poorer visuospatial function. So that involves knowing where things are in space. They have a higher burden of behavioural symptoms, shorter disease duration at diagnosis, and an older age, and also atrophy in particular brain areas. And more recently, what we've tried to do is come up with profiles that can help us predict what someone's survival with FTD is going to be like. So that can give knowledge to carers and families, how long a patient's got, and what factors they may be able to change to try and slow the progression. So what we found is that symptoms such as apathy, patients who have early motor symptoms, so those are patients who develop motor neurone disease, who have changes in their lipid profile, so actually decreased cholesterol levels actually have a poorer survival compared to those patients that have, for example, a change in eating behavior. So my research has looked a lot at how changes in eating behavior can affect progression. And actually a lot of the eating changes that patients get, so eating a sweet preference, fatty foods, are actually a benefit because their metabolic rate increases and it helps them to maintain their body mass index. So at the moment, we're advising carers not to try and limit how much a patient eats, but to let them eat as much as they want within limits. So that's really where the research is heading at the moment in terms of coming up with profiles so we can predict survival. In terms of the treatment options, at the moment, we've been limited. So there have been kind of 3 basic treatment options that are very much related to symptom management. So we've used a lot atypical antipsychotics, managing carer burden, and selective serotonin reuptake inhibitors. And if you compare this to, for example, Alzheimer's disease, so this is a slide showing all the different treatment options that have been trialled in Alzheimer's disease, you can see that the FTD world is quite far behind the Alzheimer's disease world in terms of trying different drugs to slow the progression and potentially cure patients. And really what's happened probably in the last 2 years is that groups from around the world have really come together to try and come up with specific drug treatments that we can use to try and treat FTD. And what's been developed is the FTD Prevention Initiative, which involves sites in Australia, the US and Europe, looking at trialling different drugs to try and slow the progression of FTD. And one part of this is particularly looking at patients who have specific gene mutations. So a lot of you listening may be part of the DINAD study, which is looking at patients' families, so people who are pre-symptomatic with any of these FTD mutations, and looking at the progression of the disease. And leading on from this has been the development of a number of clinical trials in FTD. One of the problems that we have with clinical trials in FTD is knowing where to specifically target the treatment. So do we start when patients are asymptomatic? And for that, we would be limiting our trials to people who have known genetic mutations. Or do we target them when patients are symptomatic or just symptomatic in the middle? And with drug trials, are we looking at things that prevent the onset of the disease, or do they modify the underlying disease, or do we look at symptomatic therapies? So I'm really excited now to tell you about 4 clinical trials that are now currently available in Australia. And at the end of the talk, I'll have an information slide that will have the contact details you can contact if you're interested in being part of any of these trials. So when we talk about clinical trials, what do we mean? Well, a clinical trial is a trial that aims to evaluate the effect of an intervention on a disease. It helps us better understand the disease and the potential treatment options. Many trials can be of benefit to the participant, but they may not directly benefit the participant, but may be able to provide more information on the disease, guide us in terms of future treatment options, and they also may help the next generation. So when we talk about different clinical trials, there are different phases of clinical trials. And this is a way that we learn whether drugs are safe and what effect they might have on diseases. So when we talk about phase 1 trials, these are the first kind of trials where they trial a drug in humans. And the purpose of these trials is to evaluate the study drug in terms of safety and identify any side effects. And usually phase 1 trials are in a small number of patients and it's trialing the drug for the first time. Phase 2 trials, they trial it in a much larger group to determine if it's actually effective in changing the progression of the disease and to provide further information on the safety of the drug. And phase 3 trials are really when the drugs are trialed in large groups to confirm that it's effective, monitor for side effects, and to compare it to other treatments or placebo where we don't give a treatment to see if it actually has an effect. And phase 4 trials are where drugs are approved by the FDA, or in Australia, the TGA. And after phase 4 trials, they're made available to the public for general use. So what I'm going to go through now is the first trial. So the first trial is a phase 1 trial. So this study is by a company called Prevail, which is based in New York City, but we have a site for this trial in Australia. And this trial is using a form of therapy that we call gene therapy. And essentially, this is a new treatment that aims to modify a person's underlying genetic makeup. So this trial is specifically for patients who have a progranulin mutation. And I think Clement covered that in his talk. And essentially, what gene therapy does is it insert, when you've got an abnormality in one of your genes, we would give gene therapy to insert a healthy copy of a gene or genetic material into a patient's cell to compensate for the bad gene or the mutated gene. And it allows the body to produce a beneficial protein that makes up for one of the faulty genes or the product of that gene that's otherwise not produced. And there are many gene therapy approaches, but Prevail is using a vector, so a carrier for the gene called AAV. And essentially, this is a slide to show what we do in gene therapy. So what we do is that we attach a new gene to a vector, which is a deactivated virus, so it can't be harmful to you. Then we inject it into the body, and then essentially it gets carried to the nucleus, which is kind of the epicenter of all our cells, and then we insert the healthy copy of the DNA into the cell, and then that produces the normal protein, which the faulty DNA was not able to do. And the study that's in Australia is called the Proclaim study, and this is running in Sydney. It's probably going to start in about December. And essentially what we're looking for is patients who have a known granulin mutation, who are aged between the age of 30 to 80 years, and they have to be in the symptomatic disease stage, so early FTD, and be on stable background medications. And it will be trialled in a very small number of patients. The good thing about this trial is it's a one-off treatment, so you don't need to come back week after week for any infusions or things like that. And what happens is that you have a lumbar puncture, which is a very simple procedure that we do all the time as neurologists, and we inject this genetic material, and then you undergo monitoring for the next 5 years to see if it's safe and tolerable and whether it has any underlying effects on disease progression. The second trial that I wanted to talk about is also specifically for patients who have a progranulin or granulin mutation, and this is by a different company called Elector. The difference about this trial is it's not only in symptomatic patients with a granulin mutation, but it's also in patients with pre-symptomatic disease. So if you know in your family that you have an underlying granulin mutation, then you may wish to find out more about this study. And essentially what they're doing in this study is giving patients an infusion of what we call a monoclonal antibody to try and increase the protein levels of granulin, which we know is low in patients who have the granulin mutation. And essentially it's just started in both Sydney and Melbourne. And essentially it's a phase 3 study, so it's a bit further on than the previous study, which is a phase 1 study. And it's looking for patients that have a progranulin gene mutation. The key inclusion criteria for this study is that you have to have a granulin mutation. You can be either symptomatic or pre-symptomatic and have either behavioural variant frontotemporal dementia or progressive non-fluent aphasia. You need to have someone who will come along for the study visits with you, and then of course we get informed consent. We know that in all of these studies, there are exclusion criteria where it's not safe to give these drugs. And the main things are if people have uncontrolled hypertension, diabetes, or thyroid disease. And if you're planning to have a family or might be pregnant or breastfeeding, we wouldn't put you in a trial at that stage. We would wait until you had stopped having your children or weren't planning to have your children for a number of years. And the main outcomes that they're looking for in this study is we're using a number of rating scales that we use standardly in dementia trials to see if there is an effect on the disease progression. And we're also looking at what we call biomarkers. So they're signs of what's going on in terms of the underlying disease. And that involves both blood biomarkers and CSF biomarkers, where we would do a lumbar puncture. This trial is a bit, involves coming every 4 weeks for an infusion. For 12 months if you have symptomatic FTD, and 2 years if you're in the pre-symptomatic stage and just have an underlying mutation. The third trial that I wanted to talk to you about is actually a trial that's had its beginnings in Melbourne. Professor Terry O'Brien has really led this trial, and essentially it's using a drug called sodium selenate, which is very safe to take. And they've already run this trial in patients with Alzheimer's disease, and now they're looking at doing it in patients with behavioural variant FTD. And they've also done a phase 1 trial in patients with behavioural variant FTD. And essentially what sodium selenate aims to do is reduce the level of tau, which we know is one of the proteins that causes FTD and is deposited in the brain. And these are the results for the phase 1 trial that they've already done, where they gave this drug to 12 patients for 12 months. And what they found was that the drug was safe and well tolerated. The impressive thing is that by giving this drug, what they found was that NeuCog is a measure that we use to measure cognitive change. What they found was that there was no change in cognitive or behavioural symptoms. And they felt that there was a slowing of brain degeneration in most patients. And that first phase 1 trial is due to finish in December of this year. But pleasingly, there is a phase 2 trial which is starting, comparing the drug sodium selenate or placebo, and the aim is to recruit 120 patients with behavioural variant FTD between Melbourne and Sydney over 4 years. So these patients don't need to have an underlying genetic mutation, they just need to have a diagnosis of behavioural variant FTD. And we'll be looking at outcomes including brain changes on MRI, cognitive symptoms, behavioural symptoms, levels of the tau protein through both blood and CSF, and whether the drug is safe and tolerable. And that study is due to begin in December or early 2021. So the key inclusion criteria for this study is that you have to be aged over 35 years. You have to have a diagnosis of behavioural variant FTD, and you have to be able to undergo a lumbar puncture and a brain scan, and you have to be living in the community. So unfortunately, you can't be in a nursing home facility, and someone who's willing to come along with you for the appointments. There are, of course, without any trial exclusion criteria, and that includes if someone may have substance abuse disorders, if they've got a known sensitivity to any of the selenium, which is the drug we're going to give, and if they have another cause of the behavioural or cognitive symptoms other than behavioural variant FTD. And if they have a history of familial Alzheimer's disease. Sometimes we see patients who have a family history of Alzheimer's disease and then have a diagnosis of FTD, and we're not sure whether the underlying disease is Alzheimer's disease or FTD. The other thing that we know will exclude patients is if we suspect that they don't have underlying tau pathology in the brain. And we know that's the case in patients who have a genetic mutation with the C9orf72 mutation or the granulin mutation. So this study is really targeted at people who don't have a family history of FTD, but are what we would call sporadic behavioural variant FTD. And they're the other exclusion criteria, which is just other uncontrolled medical conditions. Then the final trial, so we've had a phase 1 trial, we've had a phase 3 trial and a phase 2 trial. And then the final trial that I wanted to talk to you about is a phase 4 trial, which we're running out of Sydney. And this is very much a trial to look at the symptomatic management of FTD. So it won't necessarily change the underlying pathology or the disease progression, but it aims to help manage the underlying symptoms of FTD. And Olivia, who spoke earlier, is the principal investigator for this trial. And essentially what we're aiming to do is use oxytocin, which is sometimes known as the love hormone. And what we know is that oxytocin is a drug that modulates our emotional response, so how we respond to things. So what we know is that oxytocin can improve our social behaviour, improve our emotional recognition, and improve our trust and interaction with other people. And those are all of the characteristics that we see changed in patients with FTD. So what this drug is really aiming to do is change many of the behavioural changes, that lack of empathy, those emotional changes, to see if it can improve these symptoms in patients with FTD and also reduce carer burden. And so this trial is good in a sense that it's a very short trial. So it only lasts for 1 month. And essentially what it involves is that patients will come in to be screened, and then they'll be divided into half of the patients getting oxytocin and the other half getting placebo. And the oxytocin is just administered as a nasal spray. And when you first come in, you're shown how to do it, and then you can go home and you do the nasal sprays at home with the help of your carer. And then you have phone contact with the researchers and a number of one follow-up visit where we check a number of tests of emotion processing and also check blood for oxytocin levels. And then when you get to the 2-week period, what we do is swap the groups over. So the group that didn't get the oxytocin, will now get the oxytocin, and the group that got the oxytocin will then go on to placebo, but you will not know which drug that you're getting. And it's really looking at the effect that oxytocin has on patients with FTD and their emotion processing. And for this study, we're looking at doing it in both patients with behavioural variant FTD and also the language forms of FTD to see if it helps with emotion processing and also in reducing carer burden. And so these are the outcomes that we're measuring. So it's looking at social cognition and behavioural symptoms, and then also looking at carer questionnaires and carer burden, and also looking at blood levels of oxytocin. And so these are the contacts for the trials if you would like to be involved in them. So in Sydney, we've got running the PROCLAIM study. So that was the study we're using the gene therapy for patients with granulin mutations. We've also got the ELECTOR study, which is again for patients with granulin mutations. The selenate study, which is for patients with behavioural variant FTD. You do not need to have a genetic mutation. And also the oxytocin study, which is for patients with both behavioural variant FTD and the language forms of FTD. And if you email Cassandra, she'll be able to answer any questions that you've got. In Melbourne, they also have the ELECTOR study, which is running through Amy Brodman at the Eastern Cognitive Disorders Clinic. And then they've also got the selenate trial, which is being run by Professor Terry O'Brien. And there are a number of sites throughout Melbourne. But if you contact Lucy on her email, she'll be able to provide you with further details. And pleasingly, the ELECTOR study for patients with granulin mutations is also running out of Perth with Dr. Carolyn Orr. and her study coordinator is Susan Walters. He's happy to be contacted if you might be interested in those studies. Obviously, if you're not in Sydney, Melbourne or Perth, you could come to one of these sites to be part of the trial when the borders are open. So the major message I wanted to have is that I think 2020, if you had asked me in 2019, were there any treatment trials for FTD, I would have said no. But this year we've got 4 trials in the 1 year. And I know that there's probably another 2 that are on the horizon for FTD next year. So trials in FTD are really on the go ahead. And so hopefully we can eventually find a cure for this devastating disease.